Well, the first few weeks of Obamacare revealing a rather troubling trend, according to a new report in the Washington Post. The vast majority of people signing up for the Affordable Care Act are actually enrolling in Medicaid, not the private insurance on Obamacare, creating an imbalance that arguably could place a much bigger burden on taxpayers. Jonathan Honig joins us, portfolio manager for the Capitalist Big Hedge Fund. Jonathan, good to see you. You know, in many places, 90% enrolled in Medicaid instead of the private Obamacare market. I mean, look, if this continues, isn't it simply a costly expansion of an existing costly entitlement that's already on the verge of bankruptcy?
That is exactly what it is, Greg, and thanks for having me. I mean, we are seeing central planning brought to health care and the destruction that it's wrought, not fixing the health care problem or even the health insurance problem, as Obamacare purported to, but simply expanding the entitlement states. And as you pointed out, the vast majority of signups for Obamacare here in the first few weeks have been for Medicaid. 87% in Washington, 2/3 in New York, up to 100%, at least in the first few days in Oregon. Yeah. So we're not seeing an expansion to the private market at all. We're seeing the expansion of the entitlement state, and it's no wonder that a lot of people still believe, and indicated by this, that Obamacare is the role to single-payer care.
And the Obamacare expansion of Medicaid has, as you know, the feds picking up much of the cost of the first 2 years, except, and this is huge, except for those people who were eligible for Medicaid before Obamacare, and they're now just sort of getting around to signing up for it. And that, Jonathan, is a huge percentage. I'm glad you brought up Washington State, for example. In that state, it's a full 1/3 of all the new signups. My goodness, Washington State cannot nearly afford all of that.
Indeed, taxpayers on the hook for a majority of this, Greg, and unfortunately, that healthy pool, I mean, any insurance pool needs healthy people to participate, and since we're not getting the actual healthy participants in the so-called insurance program, you're likely to see their insurance premiums go up. I think even more frightening longer term is that because Medicaid does not reimburse healthcare providers for their costs, the more people who sign up for Medicaid, the more those providers' costs will go up, and the less services they'll be able to provide. So rationing is almost an inevitability as a result.
Let me pick up on that and dig a little deeper. In order for Obamacare to work, as I understand it, there has to be roughly an even split here. That is to say 7 million buying the private plans, roughly 9 million in Medicaid. That was the assumption upon which its structure was based. Well, that's not happening, Jonathan. So won't low enrollment in this private insurance cause the premiums to skyrocket to the point where nobody can afford this? It's the so-called death spiral of Obamacare.
That's exactly it. I mean, already we're seeing the few so healthy participants into these so-called insurance programs seeing their premiums increase by 50, 100, 150%. So unfortunately, instead of going in a direction of freeing the market for health insurance, freeing the market for health care, we went in just the opposite direction. And now just a few weeks into it, we're already seeing the destructive results.
And if enough healthy young people don't buy into this, and so far they are not in huge numbers. They're just not participating. That's going to leave insurance companies with the risk weighted toward the unhealthy older people who, by definition, cannot now be denied coverage. I mean, doesn't that cause the financial structure to topple over, to collapse?
Well, indeed, and it's not insurance. I mean, Greg, you know, it's interesting. The president and many who have supported Obamacare keep using the terminology of a free market. Shop for a plan, go to the marketplace, buy insurance. But in fact, that's just it's a veiled cover-up for really what is an entitlement state, an entitlement plan. So that's why you're seeing an expansion of Medicaid, no real insurance risk transfer going on, and costs going up, service going down across the board.
Speaking of service going down, Medicaid is substandard. And you know, here we have the president this week ridiculing what he calls substandard insurance plans in the private industry. His Obamacare expansion is dependent on the quintessential substandard, that is to say Medicaid. Why? Because doctors and hospitals don't want to take it. They don't like it, right?
Right. Well, they lose money on it. I mean, that's the real scary point, Greg, is that, you know, we're seeing health care hollowed out from the inside, and more people depending on that Medicaid system, and fewer doctors, health care providers actually even getting paid back, even making any money on it.
Right.
So we're going to see the healthcare providers provide less and less healthcare. They're losing money on it. The waiting lines get longer. The rationing gets larger, and the healthcare system, much as your previous guest talked about in England and other socialized countries, simply falls apart.
We've talked to so many doctors who say, sorry, I'm not going to take Medicaid anymore. And here we are expanding Medicaid. All right, Jonathan Hoenig.
You'll see a lot of that.
Yeah. Jonathan, good to see you. Thanks, man.
Thank you, Greg.